Good afternoon. I'm Eric Estes, and I serve as Vice President for Campus Life at Brown University. I have the pleasure of welcoming you to today's Healthy Brown webinar. I want to offer a special welcome to the parents and families and students who are joining us. We are fortunate to be joined by two remarkable leaders today to discuss Brown's COVID response, and they are President Christina Paxson. Christina Paxson is a noted economist and public health expert. She has served as Brown's 19th president and professor of economics and public policy since July 1st, 2012. She led Brown in the development of a strategic plan that has positioned the university to elevate academics, develop the physical campus to support the world-class education we offer, and support the students, faculty, and staff who live and work at Brown. We're also joined by Dean Ashish Jha. Ashish Jha is Brown University's Dean of the School of Public Health. He is recognized globally as an expert on pandemic preparedness and response, as well as on health policy research and practice. He has led groundbreaking research on Ebola and is now on the front lines of the COVID-19 response, leading national and international analysis of key issues, advising state and federal policymakers, and contributing frequently to a range of public media outlets. President Paxson, Dean Jha, I turn it over to you.
Good afternoon, and thank you very much for that kind introduction. Good afternoon to everybody. Thank you for joining us. And let me tell you why we decided to do this today. You know, it's still relatively new academic year. We're still in the early stages. And while things are much better than they were, say, a year ago, we're still very much living with COVID-19. And we're going to continue to live with some uncertainty for some time. We've tried to do a very good job communicating with students and their families about the steps we're taking as we learn to live with this disease. Hopefully it won't be a pandemic forever. But understandably, there's still a lot of questions. And so today, I thought we could take the opportunity to tell you how we think through the priorities as we address the pandemic, where we are with policies, what we expect to see in the year and years ahead. That's something for Dean Jha, not for me to answer. I am really grateful to have Ashish Jha here. As Eric noted, you know, relatively new Dean of the School of Public Health. He's been here a little bit more than a year. He is a leading expert on pandemic preparedness, among other things. I'm sure many of you may have seen him on a news program or two. And today he's really here to provide his expert perspective on where we are in the pandemic. So we will have time for some audience Q&A. We have some pre-submitted questions. You can submit questions during the chat. Let me just say a few words about the university's priorities as we've worked through the last year and a half now, really a little bit more. And, you know, from the earliest days, our priority has been health and safety of our community. And that means our students, our faculty, our staff, as well as the greater Providence community around us. I'm very proud that after a very brief interruption last March, we continue to advance our mission of education and research and service throughout the pandemic. Now, clearly, there were elements of campus life that we all missed, I missed, and it's been so great this year to see our students, many students back on campus, more than last year, larger in-person classrooms, a full range of student activities, athletics, our study abroad programs are coming back. So it's really starting to feel much, much, much closer to normal. I think we've been successful throughout the pandemic for a few reasons. And one is just a relentless focus on the science and practice of public health. Early on, we put together a program that really relied on public health basics, testing, contact tracing, public health practices, hand washing, ventilation, you know, things that we've learned more about as the pandemic progressed. And then most recently, the decision to require vaccination of all students, faculty, and staff, all employees, with some exceptions, of course, for religious and medical reasons. And that's made a huge impact, as you'll hear about soon. the vigilance of our community has been really important. And it's been just abundantly clear, and I'm so grateful that over the past 18 months, the Brown community, students and employees, and with support of alumni and parents and friends, has consistently come together to protect and support our efforts to promote public health. Now, many of you know that as we came back this fall, we had an uptick in the rise of asymptomatic COVID cases, primarily among undergraduates. This was not unexpected. Our peers who opened up a little bit before us saw the same thing. And, so we did what makes sense. We consulted with public health experts. We put in some restrictions. We've already seen positive results. We're removing those restrictions. One thing we've learned in the past year and a half is the need for being responsive to the data, being flexible. I think we're at a good place right now, but I think we'll continue to evolve our guidelines and our practices in ways that create even fewer restrictions and demands on members of our community. So, one thing I've learned is that early in the pandemic, I'll tell you, I had students who would, write to me in April and say, what is it going to be like on campus in September? And the answer was, I don't know. We've never been through a pandemic like this before, and I certainly can't predict the future. But I am, I think, now very optimistic, and I'm hopeful that with vigilance, we're going to continue to relax restrictions. We're continue to promote healthy behaviors and shift towards a more and more, return to what everybody hopes and dreams a campus experience is like. So with that, what I'd like to do is turn to Ashish to share his views. And I'm going to lead off with a few questions that were pre-submitted, and then we'll turn to open Q&A. So we'll have a lot of time for that. So first question for Ashish. We're seeing a lot of talk about breakthrough infections among vaccinated. And a question that everybody has is, how dangerous are these cases? How common? How long are we going to continue to see them? How should we react when we do see them?
Yeah, great. Chris, thank you. And thank you everybody for being here. And it's really a fun opportunity to just talk about where we are. And I will get to breakthrough cases in just a second. I do want to just take a moment to reflect on all that the university has accomplished over the last 13 months, certainly since the beginning of last fall, and how it has been two things, really. One has been, I think, very clear leadership from our president, who has said she wants the optimal experience while keeping people safe. I mean, the goal is to bring students back, to have as much education in person as possible, to have all the experiences that are valuable, but not at the cost of public health. And that has been the guiding principle. And I would argue that we've done it really well because of your leadership, Chris. And we are now at a moment where we have, it's a different set of circumstances in early October of 2020, right? We're in a different place. Almost everybody's vaccinated. I think the proportion of people who got exemptions is 2% or maybe less. And more than anything else, we have all the tools we need to get our lives back to a new version of normal, an experience that really is worthy of Brown. And I think that is what our goal is. Now, in that context, the question of breakthrough infections becomes important, because if the goal was 0 breakthrough infections, nobody ever got infected on campus or off, we'd be remote. We'd probably be remote for years. That is, I think, neither a good idea. I certainly don't think it's a good idea, but nor is it necessary, because the question around breakthrough infections is, in my mind, there are 3 big questions. One is, how likely are you to get really sick? And the answer on that at this point is reasonably clear, right? First of all, your chances of getting really sick are dramatically lower with a breakthrough infection than if you had an infection, if you were unvaccinated. But still, what's the risk? It's certainly, your likelihood of getting really sick is lower than your likelihood of getting really sick from the flu. For young, healthy people who have breakthrough infections, their chances of getting hospitalized or, God forbid, dying are just minuscule. Like, when one would have to kind of think about how low that risk is. So that's one issue. How likely are you to get really sick? The answer is really, really low. And if you're a super high risk person, if you're immunocompromised, if you're in your 70s or 80s with multiple chronic diseases, your risk is higher. And therefore, we want to do more to protect people who are at high risk. Another question is, what about long-term complications? So we all know about long COVID. We're actually doing some really important work here at Brown on long COVID. One of the questions people often ask is, what are the chances of getting long COVID if you have a breakthrough infection? And the answer is we don't know for sure, but it's a lot less likely than, again, your likelihood of getting long COVID if you were unvaccinated. I think most people who have breakthrough infections are going to have very mild disease. They may even be asymptomatic and will not have any long-term consequences. That doesn't mean we are cavalier about breakthrough infections, but it does mean that it can't become and shouldn't be a barrier to starting to get things that are important back in our lives.
Great, thank you. So another question, we're heading into the fall. It's getting a little colder. And, you know, this time last year, that was around when cases went up, restrictions tightened. We didn't have much of a flu season. That may be different this year. So what are you thinking for the coming months? And will vaccinations again help us deal with what's coming up?
Yeah. So what we know about this virus is that there is a seasonal component to it. There's no question. And it likes to spread and spreads a bit more efficiently in cooler, drier air, the air of New England in the fall and winter. It also spreads more efficiently, or pretty much only spreads when people gather indoors. So, and that happens more obviously in the fall and winter. So all of that would make you think that we should be very worried about the fall and winter. I am not. Do I expect that we might see increases in cases? Absolutely. Do I expect a large spike the way we did last fall and winter? I do not. And that's because we have a very vaccinated campus. And thankfully, we live in a pretty vaccinated state. I'd like to see our state get better on vaccinations, have higher vaccination rates. I think they're either 5th or 6th in the country. So pretty good, but we could be better. And we're going to keep working with our state leaders to try to find ways to drive vaccinations higher. But I think of vaccinations as kind of a wet blanket and we are heading into a season where we're going to see more sparks and more fires, but they're going to get put out pretty quickly with the very high level of vaccination. So I do not expect a huge surge as we get into the fall and winter, but we might see some bumps here and there.
Yeah. And one question that came up in the chat is, what are you doing about Thanksgiving? And I think, we're thinking about modifying our testing strategy, but the state has made it clear, and I agree, that when students come back from Thanksgiving, we'll want to make sure that they're all tested so that we know that we're not bringing stuff back to campus in the fall. So let's turn to booster shots. So for many months, we've been hearing about them. Right now in Rhode Island, they're eligible. People can get them Pfizer if they're 65 plus or if they have health risks. What are you thinking about them, Ashish? Do you think that they'll be do you think our students will be eligible for them soon? And if so, should they get them?
Right. Two questions that are related, but will they be eligible and do they need them? So boosters, I think all of us who've been following this very closely have come to conclude that this is probably a 3-shot regimen. By the way, there are other 3-shot regimens, right? Hep B and other vaccines. So it's not a crazy idea that it'd be a 3-shot regimen. And the idea, it will become at some point that it's, you get your first shot, second shot 3 to 4 weeks later, and you get your third shot 6 months after your second. That's where we're, I think, heading towards. I don't know that any of us feel ready to declare that yet, but it is really clear to me that if you're a high-risk individual, if you're older, you have chronic diseases, or if you have a lot of occupational exposure, it makes sense to get a third shot after your 6 months after your second. By the way, there's a lot less benefit if you get a third shot too early. So you got to wait at least 6 months after your second shot. Right now, we've authorized it for Pfizer. I think in 3 weeks, we're going to have it authorized for Moderna and J&J. And so then the question is, what about young, healthy people? Well, a lot of young, healthy people didn't get their second shot until April or May. So they're still not, wouldn't even be eligible. I don't think there's any downside to people who are young and healthy getting a booster. It probably will add an extra layer of protection. And I suspect that as we get into November, December, we're going to have more data for young, healthy people. And so I do think most people will be able to get boosters. And we just have to wait a little bit but I think about a 20-year-old college student, probably not critical that they'll go out and get it, assuming they're healthy, go out and get it right away. But I expect in the next 3-4 months, many of them will be eligible and will get it.
Yeah, good. And do you think looking farther ahead, I mean, can we expect that COVID vaccinations are, every fall you'll go in, you'll get your flu vaccine and your COVID vaccine, maybe they'll be combined into one vaccine.
Yeah.
Is that our future?
It's possible. That was my mental model 6 months ago. That's what I expected. I'm not sure. And the reason I'm not sure is with the third shot, we may get a lot more durable protection. We'll have to see, right? We're in a place where obviously we just don't have long-term follow-up after a third shot because Israel started doing third shots about 6 weeks ago, 2 months ago. We will have to see how long that protection lasts. My guess is that, yes, we probably will get into an annual booster, but it is also possible that we get pretty durable protection for a meaningful period of time and may not need it. So that's a much more, let's see where the data lands us.
Mm-hmm. So let's talk a little bit about the other things we do to prevent the spread of infection. It's not only about vaccines, they're public health basics. When we saw a inflection, positive inflection, negative inflection, I guess, in cases in the fall, we limited social gatherings and we restricted in-person dining. Those restrictions have been lifted. So there is full in-person dining now and students can gather with more than 5 people and things like that. And we haven't seen evidence of spread in classrooms. We haven't modified, students still have to wear masks in class. That's basically where we are. What have we learned about how the virus spreads and where we need and where we don't need masking and social distancing measures?
Yeah, great question. So fundamentally, and there's, by the way, still confusion about this and still bad writing even in the press on this. The virus is airborne. It spreads through aerosols. It spreads largely through breathing, talking, coughing. And therefore, social distancing is of some value, but it is, in fact, turns out not to be the most important thing. Let me just say 1 second why we got, I think, a lot of this wrong. We got it wrong because we had the flu model. The flu is different. The flu spreads primarily through droplets. And so surface cleaning becomes really, really important. There's a bunch of things you do for the flu that probably is not as important for COVID. So that means that what you want to do is you want to prevent accumulation of the virus in the air. And when virus levels build up to a high level in the air, people who walk in can get infected. So what does that mean in terms of strategy? So obviously the best thing is vaccinations because it will prevent people from getting infected, reduces that likelihood. And by the way, again, contrary to a lot of information you may be hearing, once people are vaccinated, yes, they can spread it to other people, but they are far less contagious. They're just far less contagious than unvaccinated people. So that's one part of the strategy. But as you said, Chris, it's not just that. What else is important? So good ventilation is awesome, right? The best ventilation we have is outdoor air. So being outside is exquisitely safe because it's got great ventilation. Air just moves around very, very quickly. Now you can create potentially an outdoor space where ventilation is awful. If you pack tens of thousands of people into a mosh pit, yes, that you can create essentially indoor air quality, but those are pretty rare. So ventilation, we've made extraordinary investments across the entire campus on improving indoor air quality, ventilation, filtration. I think that needs to continue and we'll always find ways to tweak that. Masking really does help. It reduces the amount of aerosol people exhale, and therefore somebody's infected, they're just going to exhale less. And by the way, if you have a high quality mask, you'll also inhale less, and that will help as well in terms of protecting people. My take is that the long-term strategy on this, I don't know if this is exactly where you wanted me to go, but I will just say the long-term strategy on this is the way to learn to live with this virus is have high levels of vaccination, have fabulous ventilation indoors, have a little sprinkling of testing, some strategy that you can pick up those occasionally infected people. But over time, also get rid of masking, except maybe in the highest risk situations. The packed indoor concert, where you might have 500 people in a theater, and it's going to be harder to manage everything. And there you could keep some masking. But I do look forward to a day where we can get rid of a lot of our indoor masking. And outdoor masking at this point is largely not necessary.
Yeah. Exactly. So I have one last question, and then we'll open it up to Q&A. And we have a number of questions that have come in. Is it possible to end this pandemic?
Yeah, the pandemic's going to end. Every pandemic ends.
Okay, good. But what will it become?
Yeah, it will. So it will become, well, there are two possibilities. We could try to, eliminate or eradicate the virus. I think the effort it would take to do that would be both extraordinary and largely not of interest to much of the world. So I think that is a low likelihood scenario. So then it's going to become endemic. It'll be a virus that's around. And whether it's endemic and causes us really serious problems, or it is endemic and a nuisance, is largely up to us. We can make it an endemic virus that is largely a nuisance with the occasional breakthrough infections. People don't get super sick. Our lives continue, and we're really able to manage it. All of that is, I think, both within our power, and I think we're going to be able to do that. Certainly in a place like at Brown or in Rhode Island, I think we're going to be able to achieve those. There may be parts of our country that may suffer more from some of the bad consequences, especially places with low vaccination rates and less in the way of other measures. So I think, by the way, that's going to happen in 2022. We're kind of heading towards that right now. We're kind of, I sort of say we're in a period of, at least in the US and in certain parts of the US, we're in a period where we're still in the pandemic, kind of acute phase, but we're heading towards kind of endemic-ishness. Like we're kind of entering that phase. And over the next 3 to 6 months, I think it will start feeling much more like the acute phase of this pandemic has come to an end.
Great, thank you. So I'm going to turn to the questions. There are a number of questions that Dr. Jha is, he does not set dining services policy. So maybe I'll come back to those at the end. There are a lot of questions about that, but there's some questions that I think are really, really interesting that he can speak to. One of them is, let me find this one. Somebody says that, and I won't use names when I answer these questions, their child's roommate tested positive, did the 10-day quarantine, was not tested coming out of quarantine, and apparently is not going to be tested for some time. What's going on there? Is that dangerous, or is that proper protocol?
That is absolutely proper protocol, if I can speak. It is consistent with CDC guidelines, and it's exactly the right thing to do, and here's why. If you test with PCR, which is what we have been using, what we know is there are people, not everybody who's infected, there are people who are going to continue to test positive for 4 weeks, 6 weeks. They're not contagious. What they have is little bits of fragment of the virus. And if you remember, the PCR test is not looking for viable virus, it's looking for viral fragments, specifically viral RNA. So that's why we've seen people who can remain positive for a very long time. There have been very careful epidemiologic studies, and what they show is in unvaccinated people who have an infection, they can be contagious for up to 10 days, mostly 5 to 7. So the 10-day isolation that we do for vaccinated breakthroughs, I think even that is unnecessary. They probably can be shortened to a much shorter period, but we don't know yet, and we don't have terrific data. So right now we're being cautious by keeping people in. There's no reason to test people. The CDC does not recommend it. And people should not be getting tested for up to 90 days because A, they have a very high level of protection after infection, and B, they may be positive for weeks or months, and it doesn't mean anything. It doesn't mean they're contagious, doesn't mean they're infected. They just have a little bit of viral remnants.
Yeah, exactly. So again, this is where we do follow CDC guidance pretty closely, and that's a good thing. So there are a couple questions here, and I may answer part of them, but then it'll be interesting to see if Dr. Jha agrees with my answer and has anything else to add. So one question is, what milestone or metric would cause a change to policy such as indoor masking? And, one thing I will note is not only do we adhere to CDC guidelines, we also get strong guidance from the Rhode Island Department of Health, which now is strongly advocating for indoor masking in institutes of higher education. But I don't know is there a single threshold for that if we didn't have any other considerations, or is it just really low rates of COVID?
Yeah, there are specific levels that CDC has put out in terms of infections in the community to get rid of indoor masking. You and I have talked about this a bit, Chris. The one question is, when CDC says levels of infection in the community, there's actually two questions. One is they're thinking about it in a community with both vaccinated and unvaccinated people, right? We largely have a community of just vaccinated people. And the second is, what is our community? Should we be guided by infection levels at Brown, which are now well below the CDC threshold, and we could certainly get rid of all indoor masks if we wanted? Or should we think about it as Providence, because a lot of our students live in the community and frequent restaurants? And so it's a bit tricky, and it feels to me like the better part of valor right now is to keep indoor masking on for a while longer and see, hopefully, infection numbers continue to decline across the state, and then we can make some decisions about when to peel off.
Yeah. So there's another question, which is, please discuss the factors that you'll consider in deciding to move to remote classes, especially where there doesn't seem to be classroom transmission. Is there a strong commitment to in-person instruction? And I can answer that one. There is a strong commitment to in-person instruction. And right now, the data show no spread in classrooms. We haven't been able to find any, and our peers who are teaching in person have not either. So it would have to be something very dramatic. I look at two factors. One is there a new variant that the vaccine just isn't effective against? I think that's low probability. I'd love to know what Dr. Shah says, but that would be one. The other, which would be tied to that, would be what happens if we simply run out of quarantine and isolation space and are no longer to find more. That those two things together could lead to some dramatic thing, but I think with very high probability, we're past that being any realistic probability or outcome.
Yeah, I totally agree. And my take is never say never in this pandemic, curveballs, but it's an unrealistic scenario to think we would find ourselves in that position at this point in the pandemic. We have so many tools to prevent all of that, and we're deploying them very aggressively. So the notion that we'd ever have to go to remote education, remote classes, just strikes me as, look, everything should remain on the table. It's really, really unlikely.
Yeah. So there are a couple questions about sort of we're kind of a bubble, as you noted. Our rates are very low on campus, but larger in the community and even higher elsewhere in the country and the world. So there are two questions that I think are kind of related. Maybe we can take them at the same time. One is, are we concerned about Family Weekend, which is happening in a few weeks, where lots of family members are coming? We can't certify whether they've been vaccinated or not. And then also, how are we going to quarantine students for all students or for unvaccinated students after returning from holidays? And I assume that could be Thanksgiving or the winter break. But so what's it different? How should things be different when you get mixing of vaccinated with potentially unvaccinated populations?
Yeah. So it depends a little bit on how unvaccinated, right? If it's the occasional unvaccinated person, it's probably not a huge deal. If you've got a lot of unvaccinated people. Now, my assumption, and I think it's a fair assumption, is that most parents, most family members of our students, not all, but most, are going to be vaccinated. Again, remember, worth remembering, like about 75, 76% of American adults have at least one shot. So I think that's undoubtedly where we're going to be. And we might have a few unvaccinated people. Doing anything outdoors is exquisitely safe. Again, I think it's just one of those things where if it's a small number of unvaccinated people, I think it's fine. Indoors, we're still largely using masks. I think that keeps it pretty safe. So I have not been worried about Parents' Weekend as somehow a particular risk, either for our students, faculty, or staff, or for the people traveling. Obviously, we want to remain careful, vigilant. We'll look at the data, but I remain very confident that we're going to be able to do that in a way that's going to keep everybody pretty safe.
Yeah. Yeah. One thing I would add, our plans for Family Weekend, we're going to keep as much as possible outdoors. We're going to require masks indoors. I think that's going to be important. And, we can't, I know it's a time when a lot of families like to take their students out for dinner. Encourage you to play it safe. Don't go to the most crowded bar/restaurant you can find in Providence. Try to go to a place that serves outdoors. Maybe go at an off hour, but just be a little bit more cautious. That's something that I hope all of our students are doing on a regular basis. But we decided to move ahead with Family Weekend. For those of you who can't or don't want to travel, we will have many of the Family Weekend events available virtually. And I know Eric Estes, our Vice President for Campus Life, isn't on the panelist screen, but he can take himself off mute. Did I miss anything, Eric?
No, that's exactly right.
Okay, thank you. Thank you. Good. So let me look for some more questions.
Can I, would it be okay if I just addressed some of the issues that I've heard over time is, I know there were a lot of people who said, well, why did you put in the restrictions that you did a few weeks ago? And I think I just want to address it head on, because I think, and as you obviously know, because you and I chatted about this, I was very supportive of putting those restrictions in. And the reason is not because I was excessively worried that things were going to be awful and we needed to do this, but the one lesson that I have learned personally from this pandemic is you never want to be behind the virus. Like, you do not want to fall behind. And once an outbreak gets going, the amount of effort you need to do to suppress it and bring it under control is enormous. And so what I saw in your decision, when we saw a spike, which we expected, was let's get ahead of this thing. It'll probably come down. Let's make sure it comes down. And, and we'll probably get criticism for overreacting. But the alternative is, imagine we hadn't done that, and those 80 some odd cases had become 400 or 600. At that point, you would have to put on the table going fully virtual.
Yeah.
Which is not something we ever wanted. So I thought it was exactly the right thing. It brought things under control, and now we can lift them. And for a few weeks, it was definitely frustrating for people, and I get that. But this is pandemic management, and you want to always be one step ahead of the virus. It will mean sometimes you'll look like you've overreacted. Boy, I'd rather do that than underreact and then have to get much more draconian. Thankfully, we didn't have to do any of that.
Yeah, yeah. And it's interesting too, the reactions. I know that, I heard more from parents than I heard from students. That's one. And the second is the reaction among students was decidedly split. There was a lot of emails saying, thank you for doing this. Other emails saying you're overreacting. So there's just we don't really know in any one instance whether we're making exactly the right decision. There are a range of opinions on this. Yep. And, looking back on this 3 years later, are we going to say, gee, maybe we could have done it better? Yeah, maybe, but we'll have more information then. So I think it's interesting. So one question is what the university is doing on flu shots. And I assume, Dr. Jha, that you recommend flu shots for everybody. And maybe, again, Vice President Estes could come on and talk about the flu shot provision we make in our community.
Sure. Thank you, President Paxson. There'll be an announcement tomorrow in Today at Brown that every student gets, so that they should check their email tomorrow, that there will be 8 flu clinics through Student Health Services over the next few weeks. So students will have ready access to the flu vaccine. I believe the first one is on Saturday, October 16th. But there will be 8 of them in the next couple of weeks. So students should be on the lookout for the announcement in Today at Brown tomorrow, and it'll have all the information they need in order to get their flu shot.
Thank you. So there are two questions that are coming up. I'm sorry to be jumping around from topic, but when you look at the Q&A, things aren't ordered by topic. So I'm trying my best here. One is just a very factual question, which is why the 10-day isolation period if you test positive? And that's important. So why don't we do that one first? And then I have another broader question that I think is on a lot of people's minds.
Yeah. So to be perfectly honest, I wish we weren't doing 10-day isolation. Now, that's what the CDC recommends, and that's what the Department of Health recommends. And it is the safest thing to do. I think the question is, do we want to go completely rogue off of them? I think we would want to be backed by strong data. I would feel comfortable shortening it if I felt like the data was overwhelmingly clear. It's not quite yet. My sense is we will be able to do much shorter isolations. We did think about, and I think we implemented a policy of if you test negative twice. I think Duke has done that. Others have by 5 days.
Duke is doing a study on that, and the results are just starting to come out. So that'll be really interesting to see what they find out.
Yeah, we want to be data driven. I mean, my personal gestalt is 10 days is too long, but we can't go based on my personal gestalt. We either have to rely on data or on guidance from CDC. And the guidance from CDC says 10 days. And I think the data will pan out that we can be shorter, but we got to wait for it. I wish we could do it shorter now. I just don't think we're quite there yet.
Yeah. So that leads into another issue, which is actually related to that, but also related to many other things to do with this pandemic, is the impact of the pandemic writ large on the mental health of young people. And, you know, it's hard to be in quarantine. It was hard for a lot of students to have to study remotely last year. You know, lack of social contact, all of this adds up. What are you seeing and hearing from colleagues and reading about with respect to mental health? What more can be done to support the mental health? And I would say not only of students, we're hearing from Brown employees as well. And this is a national issue, not really just a Brown issue.
Absolutely. So I think we will be able to see the huge negative mental health effects for years coming out of this pandemic. The single biggest thing we can do to minimize those mental health effects is to control the pandemic effectively, and therefore have less isolation, less remote, less quarantining, all of that stuff. So I think obviously we're trying to do that. The second is at this moment, just really trying to be hyper aware to these issues. And, you know, Eric and I have had lots of email exchanges of situations where I've heard about concerns. I think the university has really done an extraordinary job of being extremely proactive on making sure that for primarily our students, but also for our faculty and staff, that we have really good mental health services available to help people get through this time. And then there is a broader policy and health systems set of questions, Chris, as you alluded to, which is this is not a Brown or a Rhode Island problem. This is and by the way, this is our students, but it's also younger kids, a lot of teenagers, obviously adults. And we've got to do a lot better on providing mental health services for people, helping people adjust. There are still people who feel a lot of anxiety about even coming back. We've got to help people reacclimate. There's a ton of work to be done. My hope is certainly our school is going to be engaged in a lot of the kind of educational and research work on that. But we also need a lot of policy efforts. And then as a university, I think we've been doing a lot and continue to plug away at really being as forward leaning into these issues as possible.
Yeah. No, it's I don't know, Eric, if you want to add anything on what we're doing to protect the mental health of students on campus. I know your team is doing great work.
Sure, this is a really, really important question, as both of you have shared. This was something that we were very concerned about, and quite frankly, are a leader amongst our peer institutions before the pandemic in terms of thinking about mental and emotional health and well-being of students in terms of access to clinical therapy appointments, the ability to talk to a therapist 24/7 live. We've instituted, since the pandemic, new telehealth and teletherapy resources for students. And I think it's important to recognize that the resources are both clinical but non-clinical. So how are we thinking in a holistic way about wraparound support for students? And I think being back in person in so many ways right now is really helpful. So there is a greater opportunity for students to interact with each other, but also with faculty and staff. So if a student is struggling, the ability to identify that student and make sure they get the outreach and a little extra support that they need is really very, very important. So it's something that we're focused on and working very hard around.
Thank you. So I'm seeing, we talked about travel and returning from breaks just a little bit, but there are a number of questions about how to handle Thanksgiving. And, for families, how are you going to handle Thanksgiving? It's worth thinking about. Just on university policy, I know that some universities are telling students they can't go overseas during Thanksgiving. There's some rumor that, we'll go remote after Thanksgiving. Right now, Brown is planning on students can go away during Thanksgiving. They can come back after Thanksgiving. They're welcome to. In fact, we want them to because classes are in person. Almost all, unless faculty decided for pedagogical reasons that online work better. We will, regardless of what the testing regime is prior to Thanksgiving, and we're talking a lot about when and how to ramp down on testing for vaccinated students, we will almost certainly require a re-entry test for everybody coming back after Thanksgiving. But there's a more general question about, what steps should people take? Should they be doing, buy rapid tests at the drugstore and taking tests before Thanksgiving dinner? Should they eat their turkey outside? What should they be thinking?
Eating turkey outside, I think, is realistic in some places in America, but harder in others, right? So I don't think, first of all, that we largely need to be eating turkey outside. This was actually a really tough issue last year where I found myself recommending that you try to find outdoor spaces. Let me sort of say a few things about Thanksgiving, the holidays that'll follow, how to think about these things. So first of all, there's no simple, straightforward answer. I mean, and again, but the way I have thought about it is high-risk people for whom a breakthrough infection could be a real problem, should get a booster before Thanksgiving. So if you have, elderly parents or grandparents or people with significant chronic diseases, they should just get a booster. That will provide a very high level of protection. Again, nothing is 100%, but breakthroughs after boosters are very, very uncommon and very, very, very rarely cause anything significant. If you're eating in a all vaccinated family, again, the risk here is really low. It's not zero. You want to drive it lower. You absolutely could go out and get those Binax Now tests that, again, we're having some national shortages. We will have more of them in the next 3 to 4 weeks. They cost about $5-7. My hope is they'll get cheaper. And if everybody tests and everybody's negative, boy, at that point, your risk of someone introducing the virus into a Thanksgiving dinner is so exceedingly low that, and again, and of course, social media amplifies it. You'll hear the one story, it happened in my family, and then everybody will freak out, but it's just exquisitely low risk. I feel very comfortable. I have elderly parents. I'm going to see them over Thanksgiving. I feel very comfortable seeing them and not throwing in testing on top of just the regular vaccine and stuff. But people may differ on that. And that's one way you can add a level of protection.
Great, thank you. So I thought we could I know that there are a lot of parents on this event, which is great. And just talk a little bit, and maybe I'll ask Eric and Ashish to say a few words, and I can give my own example of what life is really like on campus. I'm getting a lot of questions that some of them make me think that students don't always communicate back to their parents quite as frequently as they should. As somebody who's had kids go through college, I understand that completely. But questions like when can they get back to in-person dining? We have in-person dining. It's not restricted anymore. Things like that. We are trying to be really creative about, especially now when it's beautiful here. Well, maybe not today, it's raining, but over the weekend it was beautiful. Having just fantastic events for students. Last weekend, just an example, I hosted a food truck festival. So we had a bunch of food trucks in Rhode Island are famous. So we had food trucks, students had tickets, they could get a Dell's lemonade, another Rhode Island classic, and something from the food trucks, and come by my house, and I got to talk to them. It was great. We had swag. So that's the kind of thing that we're doing, not only to keep people safe, but really to rebuild a sense of community coming out of COVID. You know, one thing that happened in the past couple of years is a lot of students weren't here. The classes, the freshmen and first year, second year, third year, fourth years, they didn't get to mingle as much as they normally do. And so it's great to have these kind of events that promote community building at Brown, because the Brown community is one of the most important aspects of a Brown education. So that's just one example. I don't know if Eric or Ashish, you want to add anything about the types of things that you're seeing on campus or doing with your students or your faculty or staff to bring people together again.
I suspect Eric's going to have a lot more to say about this. So I'll say a couple of quick things. You know, Chris, this is my second year at Brown, as you know. And my first year at Brown was last academic year, which was a very odd year in the history of Brown University. So I would come into my building and it was largely empty and I never saw anybody. I barely ever saw faculty unless I went for walks with them. And this feels so different. Like I walk out of my office and there's a classroom not far away. And I often get to elevators with students and we chat. And we're starting to have, you know, getting faculty and staff and students together for meals. It's lovely. Like it's not quite 100% what it was before, but boy, it's so much closer to what we all thought life would be like if we hadn't been hit by a pandemic. So my personal experience has been this dramatic shift from a strange year to what feels like, you know, a pretty reasonably normal one with some modifications, but really feels very different and obviously much better. But Eric has a broader view on this, so I will let him share his thoughts.
Well, I just thought I'd share a couple of quick differences last year to this year that I think are striking, and it really comes down to the community building. I think being able to have athletics again is a big deal. I think student organizations, being able to organize meetings, activities, events has been really wonderful. A lot of the student experience is student driven here. And when that wasn't possible last year, I think it left a real void in terms of how community gets built. And I think this is something, President Paxson, that you gestured to earlier, but a lot of the organic interactions that happen, students hanging out together and running into each other on the main green, going to and from class and getting to talk to each other and getting to know each other. We've talked about the in-person dining, hanging out in the dorm. These are the kinds of interactions and the kind of community that's difficult, with all humility, for middle-aged administrators to reproduce in a pandemic. And it's really wonderful to be able to see students have that kind of life again in a much fuller way. And so I don't mean to suggest that it's entirely typical, but so much more of that ability to be in community together is really, really important.
Yeah. You know, I want to ask Eric to say a little bit more about Family Weekend coming up, and hopefully many of you will be here. But given that there are a lot of questions on dining, let me say this. I was, you know, we closed dining, in-person dining briefly. We shifted to grab and go, and then we went back to open dining. So we're in a good place there. There have been complaints about wait lines in dining, which are very real. And you know, as an economist who's looking at the national scene, especially around labor markets, there is a national shortage right now of frontline service workers. So we are working to build up our staff. It may take a little bit of time. Hopefully we'll get there soon. I think that as rates come down and vaccination spreads, people will come back into the labor market. They'll be willing to work in these frontline facing positions. And that's something that we're focused on, and I'm sorry for it. It's a national issue. So something we want to get right. So there was a question about whether Family Weekend, somebody hadn't heard about it. Hopefully you have heard about it. First year, families of first year students tend to come in greater numbers, but it is open to any family member who wants to come back to Brown. And we have some great things planned. I don't know whether, Eric, you want to say a little bit about that, water fire. I think it'll be a lot of fun.
Sure, just to add a couple of things to what you've already shared. Just to remind everybody, it's the weekend of October 15th to the 17th. There's a full schedule of events online. I think they can probably share a link in the chat. More than 2,000 families have already registered. To your point, usually it's first-year families, but I think a lot of families are going to come because they either haven't had the opportunity in the past, or we all really appreciate in a different way the ability to be in person in community together now. And so there's going to be a full weekend of events for people to attend. Many of them will be outdoors, so dress for fall New England weather. And if you're not able to attend, to a point that was mentioned earlier, a lot of the events will be live streamed on the website. So you'll still be able to participate. And there is the special treat of a special Brown Family Weekend tent at Providence's premier outdoor event, Waterfire Downtown. So a collaboration there that promises to be really exciting for families.
And one question just came in about graduation. So we are planning for a normal graduation over Memorial Day weekend. So if you have a senior graduating, get your reservations. We're unless something goes badly awry, it'll actually be a really interesting graduation because we've invited members of the class of 2020, as many of them as can come back, to join us at graduation, which will be really fun. So, but, separate ceremonies for those two groups so that we're not watering down the festivities for any one class of students. But yes, please get ready for that too. So let me ask one more question, and I'll ask this of Ashish and Dr. John, also Eric Estes. Let's look up a year from now. What do you hope things will look like? What do you think they'll look like in terms of the campus community, maybe the country as a whole? And what do we need to be doing now to get to that kind of positive vision of the future?
Yeah. So we've obviously, if you compare last October to this one, dramatic improvements. I think a year from now, things look much, much better yet. I think that we'll see low levels of the virus still around in America. I also think a large chunk of the world will be vaccinated. I think people are underestimating how quickly we are vaccinating people around the world. There are real pockets of problems with global vaccination, don't get me wrong, but I think that'll be different. And that is, of course, very helpful, even for thinking about it from a Brown perspective, because we're a pretty international university. So having much of the world vaccinated will make a big difference. There's some interesting questions about long-term. What are the kind of modifications we need to make to our facilities? Do we always want to have a little bit of testing available as part of the strategy for keeping people safe? How are we going to think about the things that really, really matter to us that can only be done indoors? I'm thinking about theater, right? Where people get pretty packed in. All of that, I think, certainly will be 100%. My hope is it'll be pretty close to 100% for this year, but it'll just feel safer and better. And I think in many ways by next fall, there will be days, weeks on out when we will not think about COVID. And I look forward to that day where we can just say, yeah, COVID's a thing, we got to deal with it, but it doesn't dominate our lives. And my hope is that day comes even before next fall. Sometime over the spring, it really starts lifting, but we'll have to see. And again, precise predictions about pandemics are always fraught, but I'm very optimistic about what next year brings.
Good, thank you. Eric, I don't know if you have any.
Sure, just a very quick thought. I mean, I'm a PhD in history, not a medical doctor, so I'll leave the medical predictions and public health predictions to my colleague. What I would say is that I hope we've learned a lot over the last 18 months, and by that point, longer. And I hope we take some of what we've learned forward in terms of how we think about community. What is it that we really value? How do we help people re-engage in person after extended periods of time when that's looking very different, and some of the opportunities and challenges that provides? And I gestured to this earlier, but how are we thinking about the ways in which we support students? We've learned a lot about telehealth and teletherapy over the last 18 months in ways that I think people were resistant to either on the access side or the provider side a year and a half ago. And I hope we take some of those things forward because we can always be thinking and doing better in terms of how we work with and support students.
Yeah, you know, one thing I would add, I can answer my own question is, you know, we want to be a residential community primarily. We want students to learn in person. We want them to be around each other. But we've also learned that we can do a lot of education remotely too, in a very high quality way. So as a university, we're thinking about, okay, can we take those lessons to Eric's point and use them to be really innovative about what a study away or study abroad experience looks like? Mm-hmm. Can we promote more experiential learning where students have the opportunity to beam back into Brown to take that required class, something that may have prevented them from doing study in Washington or Italy or you name it in the past? So we're thinking about that. And we're also thinking about very creative ways to take all of the knowledge that's generated at Brown and all of the expertise and make that available to new communities of learners, whether that is high school students from resource-poor high schools to people who are many years out of college who want to learn about something. And maybe just as a final wrap-up, Dr. Jacques could say a little bit about the course, online course that he taught with Dr. Megan Rainey on pandemic preparedness, which was extremely successful and a model that maybe parents can sign up for things like this in the future.
Yeah, absolutely, Chris. And you know, as President Paxson said, one of the things that we did a lot of thinking about in this past year is how do we deliver education in new ways that reach new audiences and are impactful. And one of the things that as I've watched this pandemic unfold very closely is we've seen and know all about the challenges. We've also seen incredible solutions. We've seen people solve very complicated problems. And those are people in public health, those are businesses. And so Dr. Rainey and I put together a course with the help of the Provost's office called Pandemic Problem Solving. And basically it was a course where we had students from around the country taking it. It was really focused on how do you confront the problems you face in a health crisis and what are strategies you can use. And we had amazing people. We had the health commissioner of New York. We had the governor of Michigan and giving kind of very tangible answers about how do you solve complicated problems? How do you manage things? We also had business leaders and people working on supply chains. And it was great. I learned a ton. I thought I knew a lot going into the course, and I learned a lot more than I knew. And it also made me realize that kind of educational offering is very much in Brown's sweet spot. We have extraordinary faculty around the university. We can tackle big challenges, and we can put together courses relatively quickly and deliver really high quality information that's useful for people when they need it. So my hope is it's a model for a lot of other stuff we do, of course, in public health, because that's where I focus, but really more broadly across the university.
Right. So let me close. I want to thank Vice President Estes for being with us today. I want to thank Dean Jha, not only for being here today, but also just being such a wonderful voice of, you know, good data, good evidence, good suggestions and information throughout this pandemic. And finally, I want to thank everybody who joined us today, parents as well as students, and a lot of questions that we didn't get to. There will be opportunities over family weekend or other opportunities to get those answered. So I thank you very much for coming, and I hope the rest of your day goes well. Thank you.
Bye, everybody.